Namaste, Dr. Shekhar, for inviting me to this conference. And it's my pleasure to be here at Global Ayurveda Conferences. So, my today's topic is Ayurveda for Pleurisy. And I'll be presenting my patient story. So, let me share my PPT. Okay. Okay, so here you go. Ayurveda for lung care. And my topic is Ayurveda for pleurisy. I have a disclaimer before we go further. The sole purpose of this presentation is to provide an educational information about Ayurveda. This information is not intended for use, treatment, or cure of any disease. If you have any serious acute or chronic health concern, please consult your family physician or healthcare provider who can fully assess your individual needs and provide the care you require. The contents of this presentation or workshop may not be reproduced in a part or the whole without the permission of the author. So, my next slide. What is pleurisy? So before I present my client's story, I just want to explain what is pleurisy and how Ayurveda looks at this disease. So pleurisy is caused because of the irritation of pleura. Pleura is the covering that covers the lungs. When pleural layers rub against each other while breathing, it causes sharp pain in the chest. Sometimes the patient feels the pain in the back as well. There could be other causes like viral diseases spreading from the lungs to the pleural cavity can generally develop the pleurisy. In Ayurveda, this condition is known as Parshva Shol. In short, the aggravation of the pleura, which is the film covering the lungs, is known as pleurisy. So pleurisy is otherwise called pleuritis sometimes. Ordinarily, when we inhale, at that point, the tissues that lines our lungs and the chest divider, they rub together. So that's the pleurisy causes. So there are many causes of it. One is bacterial. So sometimes the patient have bacterial infection, pneumonia, viral infection, then other parasitic contamination. Sometimes swimmers, it happens in swimmers, or any environmental exposure. Tuberculosis, pneumonia, I already explained. Rheumatoid arthritis can cause. So those are the causes. The next slide. General symptoms. So these are the very general symptoms at the beginning. Pain in chest or back, or sometimes both. Cough, it is chronic cough. Sometimes it's there for a long time, or sometimes it's just a little cough. difficulty in relaxing. So when you are relaxing, you feel more pressure on the chest, or difficulty in resting. Sometimes patient doesn't know on what side to sleep because it is difficult um, when there is a pain after the pressure gets on the wall of lungs. Fever. Next slide. So, what is Ayurvedic view in terms of pleurisy? So, in Ayurveda, it's called Parshvashul, and it is due to the disturbance of kapha. So, according to Ayurveda, all three doshas, Vata, Pitta, and Kapha, play roles in causing this Parshvashul. So vata gets aggravated and collects from the body into lungs. And this leads to accumulation of kapha, which is thick. And since pitta is hot in nature, it liquefies kapha and converts it into watery fluid. As a result, there is accumulation of fluid in lungs, which causes that discomfort while breathing or relaxing or resting. So aggravation of kapha can extinguish the gastric fire and hamper the digestion. So effective, so that is again possible ama accumulation. Effective treatment is available in Ayurveda for Parshvashul. So the next style, which is the Ayurvedic protocol and the management in this case. So the first thing is the lifestyle advice, because lifestyle management is the biggest part in Ayurveda. Pleurisy is an intense condition that endures for a long time period. The individual should take plenty of rest and stay away from heavy work, exercise, go out in cold or rain. So these are all lifestyle advices. Avoid air conditioning or hot sun and exposure for a long time, exposure to sick people to avoid. Then light, warm, and nourishing food to be taken. Avoid cold water, frozen beverages, frozen yogurt, and whatever is cold in nature. Fried and refrigerated food needs to be avoided. A good, warm, nourished food is recommended, and the herbs and spices are recommended in Ayurveda. That is the Ayurvedic management protocol. So, what are the herbs recommended in Ayurveda? Trikatu, which is black pepper, ginger, and long pepper. Holy basil, turmeric, giloy, ashwagandha. So those are the recommended herbs in this type of condition. So this is the client story. This is actually a client who came to me, and how we weaned off the prednisolone together and how she felt better. So this is a story in her words, because she wrote me a letter. She wrote this in the media, and she also made this recorded story for me one time when I was presenting a paper in the conference. So, and then she started bringing her friends, and her whole family became patients. So this is again in her language. 2 years ago, I suffered from a severe case of pleurisy, which is the inflammation of the lining of the lungs. It caused excruciating pain every time I breathe, and I was hospitalized twice. I went to every specialist, to almost every field of medicine, and was finally prescribed prednisolone. But I was still in pain and told to wean off of it due to the side effects. No traditional doctor was able to tell me how to wean it off. The doctors wanted to put me on methotrexate, which is a cancer drug, but I refused because of the list of the side effects. That's when I discovered Miss Jaya Daptardar, who suggested three simple supplements and some dietary changes. Within a few months, I was off the prednisolone and pain free. She saved me from debilitating and very scary condition. I have since brought my daughter, who suffered from chronic case of acne, to see her. She's experiencing great results for the first time in 8 years. Thank you, Miss Daptardar, and she's from Hartford that she wanted to mention. Let me tell you, she was 45 years old when she came to me, a white Italian female teacher. When she was tired of going from doctor to doctor, she was trying to find alternatives and thought that Ayurveda is the best choice for her. As a teacher, she did a lot of research about Ayurveda and how it works. She was in pain when she came. She was experiencing pain while talking and had a little bit of cough. No fever. She did not have fever from the beginning, but felt pressure on chest while working. There was no previous history. She did not have any other conditions. She might had flu-like symptoms, but she said she didn't do any labs or anything, so she was not sure if that was flu or um, just the regular cough. So her doctor sent her for chest x-ray and diagnosed it as a severe case of pleurisy. She wasn't digesting well, but her typical food was also heavy, cheese and all Italian food. And she was busy with work and kids and did not pay attention to her lifestyle management, but she knew that it was important. She was a Vata Kapha type of personality, and it was late fall season when she came to me, which is always a flu season in Connecticut. So next slide is the recommendations. So, like I said, she did not have any other problems. So, very simple protocol was recommended at the beginning because she was on prednisolone and needed to wean off of it. So, just trying not to have so many herbs, should not have any drug interaction. So I asked her to continue contact with her physician to wean off her prednisolone in coordination with the protocol given. And she was taken 10 mg prednisolone a day. That means 5 mg BID. Lifestyle management was given for her to follow. Warm food, warm kapha pacifying diet with strong spices was recommended. She was familiar with Indian food, and she actually did some research on those spices like black pepper and ginger and turmeric, how to use. And started using it, and followed all do's and don'ts that I gave it to her, like no cold food right out of the refrigerator, no cheese or fermented food, avoid walking in cold weather or rain, hot fermentation on the chest with eucalyptus oil, hot water shower 2 times in a day, abhyanga with warm sesame oil uh, was recommended. No heavy activities or exercise. Take plenty of rest, but not afternoon naps. Warm water or warm teas with ginger, basil, turmeric, and honey multiple times a day. And she actually learned how to make and followed thoroughly. She's very OCD type of person. So if you give something, she literally follows and follows for her family too, since then. So herbal supplements were given, like I said, simple protocol was given. Trichodu tablets, combination of ginger, black pepper, and long pepper for pacifying kapha. Ashwagandha to boost the immune system, and it also gives strength to the muscles. Triphala tablets as needed for detoxifying body, and she understood why it was given and when to use. Giloy recommended it was used to it is used to remove the toxins. It was given after stopping the prednisone. Okay. So reporting, and she was supposed to report and follow every week. She was very good of making spreadsheet and following up every week. So she reported after a week and said that she's feeling much better in 1 week. Reduced her prednisolone to only 5 mg per day, and then in a couple of weeks it's reduced to half of it, and then alternate day, and then wean off to none. So she had maintained a spreadsheet to follow everything that was recommended to her very seriously. She took the lifestyle management and what needs to be done. She continued to report her progress to me, and then in 3 months, she reported that her X-ray showed the improvement, and her doctor was surprised by the results at that time. And it was at that time she was completely off of steroids and was just following Ayurvedic protocol. After that, for months, we kind of slowed down with the protocol, but it continued for the whole winter because I wanted to make sure that it won't come back in the winter because of the winter season and the lifestyle of the family. And she continued as recommended, and then she was fully fine after 4 or 5 months. She was completely went on her regular lifestyle. So thank you very much. Okay.